in listen-only mode.
Hello, and welcome to our webinar short on the RWJF Culture of Health Prize, Finding Reward in the Journey. This 20-minute webinar will focus on the value that comes from applying for the RWJF Culture of Health Prize, and we'll hear from a community that has used the application process as an opportunity to reflect on their efforts and make adjustments. We'll also have time for some of your questions. My name is Karen Odegaard. I'm a community coach with the County Health Rankings and Roadmaps program, and I'm joined by my colleague, Ali Havrola.
Good afternoon, everyone.
Ali is going to be fielding your questions and comments throughout today's brief webinar. We are also pleased to have John Mooney with us from the Springfield Greene County Health Department in Springfield, Missouri.
Hi, thanks for having me.
All right. The County Health Rankings and Roadmaps program and the RWJF Culture of Health Prize are both done in collaboration between the University of Wisconsin Population Health Institute and the Robert Wood Johnson Foundation. Thanks to support from the Robert Wood Johnson Foundation, we're able to bring you this webinar today. We like to ground our webinars in an essential question. Our intention is that today's webinar will help you answer this question. How can we find value in the process of applying for the RWJF Culture of Health Prize? But first, a little background about the prize. The RWJF Culture of Health Prize was developed to honor and elevate communities that have placed a high priority on health and that are creating powerful partnerships and deep commitments to make change. Each year, up to 10 communities are selected as prize winners. These communities are beacons of hope and progress for healthier people, families, and places. The 2016 winners will be announced on September 14th, so watch for that exciting announcement coming up. Prize winners receive a $25,000 cash prize for what they have already accomplished, which communities can use in any way that they choose to enhance their work. Beyond the cash prize, we often hear from winners that perhaps the most valuable benefit of winning the prize is that representatives from winning communities become ambassadors for building a culture of health across the nation, sharing their successes, learning from others, and networking locally, regionally, and nationally. The prize offers a national platform for winners to tell their story and access the network of prize-winning communities who continue to engage in sharing and learning opportunities with each other. You can learn more about the prize in our call for applications, which you'll find in the handout section, as well as online at rwjf.org/prize. And I think Ali should be chatting out some links about the prize now.
Yep, I just shared the link to look at the prize winners.
Oh, super. Thanks, Ali. If you'd like to learn more about applying for the prize, I want to encourage you to join us for the 2017 RWJF Culture of Health Prize Call for Applications informational webinar. It's a mouthful, and it's going to be held on September 22nd. We will be including a link in the chat below, so you can go ahead and register for that webinar as well. And then I also wanted to highlight some of the key dates for the 2017 prize process. Phase 1 applications are due on November 3rd, and then you can see some of those other key dates throughout our process. I'm going to turn to our guest, John Mooney, now to talk about why his community applied for the prize. The City of Springfield in Greene County, Missouri, has advanced to the second phase of the application process in previous application years and has tapped into our other county health rankings and roadmaps resources as a result. John has been with the Springfield Greene County Health Department since 2013. In this time, he has worked with community partners to complete the community's first joint community health assessment and is one of the lead staff coordinating the community's health improvement plan. Prior to working in public health, John spent 8 years with Jordan Valley Community Health Center, the local FQHC, where he focused on chronic disease treatment and implemented a robust employee wellness program. John received his bachelor's degree from Truman State University and his master's in health promotion from Missouri State University. He has called the Ozarks home for more than 13 years with his wife and 3 children and enjoys running and reading. John, thank you so much for being with us and for sharing your community's perspective on the prize application process. So let's start with the most basic question. Why has your community applied for the prize? What was it that drew you to the RWJF Culture of Health Prize?
Sure. Yeah, and I would say this all started probably back in 2010 or 2011 when our community came together to really start focusing more on the health and really focus on those collaborations to help drive our community healthier. And we really started with 2 things, and it was really tobacco and obesity that started driving a lot of that change. And after several years and several grants that we'd been able to implement a lot of change, we started to ask ourselves, or started to feel like we were doing pretty well. Unfortunately, we didn't have a great way to measure some of that change. And so it really started to beg the question, well, how do we really know that we're doing well? How do we know what we're doing is making a difference? And really, how do we compare with others in the nation? Because we see that other communities are constantly doing great things and implementing change and developing best practices and sharing those. How do we know how Springfield stacks up? Is it middle of the road? Are we doing pretty well? Or are we really far behind? And I think as we've gone through this process, we found yes to all of those, depending on what we're talking about. The other thing that I think was really attractive to not only me, but our community partners was, sure, the $25,000 is a fantastic thing, and we'll never turn away money. But the thing that really attracted me was being connected with that network. To be able to have the opportunity to go see more of those communities and talk with those communities about ones that have either gone through this exact same struggles that we've gone through or have come through those struggles on the other end that we can learn from. And just to be part of that process and to be part of that network for us was a huge incentive to initially apply.
That's great. Thanks, John. I think that's a really important point and really reflects what we actually have heard from prize winners, that, again, that network is so valuable, and being able to connect with other winners has been really helpful. So I think that's a really important opportunity that is worth going after when you're thinking about applying for the prize. The money is helpful, but it's not just that, right? You know, there are other opportunities that come along with the prize. So I think that's really helpful to think about why you apply, but I'm wondering, as you went through the process, did you find value in the actual application process?
Definitely. And to be honest, I was quite surprised as I went through it at how much value we took from the process of applying. I think, again, like I said, we started out around things like healthy eating and active living and tobacco and addressing things that way, which are all great and certainly part of a community or a healthy community, but that's not it. And that's not the whole picture, I guess I should say. And really what we're trying to drive is exactly what you call it, that culture of health. How do we really frame our community to be one that values health? And trying to measure that is a huge challenge. And I think that's one of the things that's so nice about this application process is that it's not an inordinate amount of time to put together an application. Of course, it has to be thoughtful, but the fact that you make communities think about the culture of health in a very definable concept that you can really wrap your arms around. All right, what are these 6 things? And it really forces you to look at those, and not just the programs or the policies that you've implemented, but how is it well, not specific to just one area. And it really forces you to broaden your perspective and really say, how are we making a change throughout the community and not just in one area and not just in one way, but to really broaden it out. For community specifically, we've had many come in and tell us from the outside and say, we do an outstanding job with programming, but we don't do that well with system and policy change. And we've certainly been working on that over the last year to maybe 3 years. And at the same time, we've had an immense amount of efforts trying to address poverty. Well, the application gave us the platform to talk about health within both of those settings, about how do we move from a program-rich, system-poor community to one that has a greater priority on systems as well as how is health part of poverty? And it really starts leading us down the path into kind of the health in all policy approach, that it's not health policy, but every policy is going to have impacts on health. So this application really helped give us our foot in the door as we started talking to more community partners about what is this application that we're going through. And so we've been able to, like I said, it's really opened those doors for us to get in and start talking about health in a more broad sense with community partners. It's also given us a chance. We've applied now 2 years, and it really gave us a chance to stop and pause in our busy, crazy lives and our plans that are constantly in motion. And it gave us a chance to stop and reflect on really what are we doing in a snapshot in time. Where does our community sit? Which we don't do that often. And so I think, again, since it's not hundreds and hundreds of thousands of dollars, that it has to be this really strong program plan, it stops and says, what have you done? And really, how have you placed that value on health? So to me, that was another very valuable one. The other thing that I think that we got immense value from, although we did not make it to the finalist round, that last round, which we hope to do this next year, we certainly, where we had the opportunity to connect with a community coach, and we jumped all over that opportunity, and that has been one of the more valuable things as we've gone through the last year or so working with that community coach to, again, help us to continue to think about systems. So I think that those are just 3 ways that this application process itself was helpful to our community.
That's great. Thanks, John. I think, one of the things that you commented on that made me think of another thing that we often hear from applicants is that it really gives you this unique opportunity to put together the story of your community from a much broader perspective than, applying for a grant for a specific program or a specific policy initiative. You really get to tell the story and put together a story of your whole community and what's happening there. And I think that can give communities a really great opportunity to reflect and really feel a lot of pride in the work that they've done. Can you talk a little bit about what has changed or evolved for your community since you applied?
Sure. Well, and I want to, I guess, preempt that just briefly with the thing that I think was so important for us too was applying year 2. And I'll be honest, I didn't want to apply for year 2 because I didn't feel our community was ready to take that next step to be a finalist. And we actually had several community leaders encourage us to go ahead and apply because they felt like we had made some changes. And so we went ahead with that application, and there was immense value in that second time in applying because it gave us a chance to compare, all right, really, how do we look our first year? And I think some things we had stayed somewhat stagnant and some things we had really moved forward with. But one of the things that it really highlighted is that we are doing much better thinking and putting those wheels into motion to start making system change. That we're getting people to stop thinking about just programs as a solution. While programs are essential, they have to be supported by and built kind of on the chassis, if you will, of a strong system and a strong policy that supports those programs. And so I think that that's certainly something that we saw from year 1 to year 2. And even as we reflected back on year 1, was that, or either of the years, we saw, all right, we really need to mature in some of these areas. And so we've been able to do that policy and system change. And the other thing that I would add is just a good testament to that is we recently have adopted our community health improvement plan, which includes 20 to 25 objectives, and not a single one of those is programming. So, and I think there's no way that would have happened, that we would have been that intentional and that focused on that policy and system change if it hadn't been for the process that we've gone through with the culture of health.
Fantastic. Thank you so much, John. We want to take some time now to see if our audience has some questions for you. So I'm going to turn over to Allie and see what kinds of questions we've seen from our audience today.
Yeah, great. Thanks, Karen. John, we've got a question here. How did you decide that Springfield was a candidate to apply for the Culture of Health Prize?
Sure. Yeah. As we looked at our community and why would we apply and why do we think that we would have a shot, like I said in the beginning, I feel like we as a community felt like we had a lot of things right. We'd been able to form this local coalition that was really driving a lot of our change in our community, and I felt like we had been able to really start to turn the tides and do with some creative branding and some things to get our name out there, especially around the areas of healthy and active living, that we were starting to change that culture a little bit. But the other thing, again, that first year we were much more focused on that. We have a great park system. We have, we have 2 great healthcare systems, and really when we thought about it and didn't broaden our perspective, we thought we have a lot of things really down pretty well in our community. So I think both in the existing infrastructure and the organizations and some of the more recent work that we've done, I think really pushed us towards looking towards applying. And it was also nice to receive some of that confirmation by making it to that next round is, hey, yeah, we do have some things going well. We didn't, obviously we didn't become a finalist, but in that second round of application, the second round of the application, which one of you two might elaborate on that in a second, is being able to receive feedback. And it's the best feedback I've ever received from a grant application, and being able to get that and give us specific things to work on that we can improve and continue to drive our community forward. That was also an invaluable thing for us.
Allie, let me just chime in really quick on and say a little bit more about that second phase that John was referencing. So I'm going to put our key dates, our timelines and key dates up here again. So we have the RWJF Culture of Health Prize is a multi-phase competition. And the first phase is, again, that deadline is November 3rd, and there's lots of opportunities to learn more about that on our informational webinar. And you can learn more about the overall process. But then there's select communities are then invited to apply for phase 2. And that second phase, what we have done is we provide some written feedback to communities, letting them know what areas, which of the 6 criteria they did, particularly that we thought we saw some really great strengths, and some areas where we thought we saw some opportunities for improvement. So I'm putting those 6 criteria up again as another reminder of the criteria that we look at in the Culture of Health Prize. We also try to provide feedback at the end of phase 1 as well, but that's a little bit broader feedback, and we do it in the form, we've done it in the form of a webinar for communities that are not advancing to the second phase, and sharing what some of the broad themes or that we learned or that we saw from the applications, and what made applications successful, and which ones needed or what were some opportunities for communities to rethink or to improve their application, I guess would be a better way to say. So thanks for letting me just chime in with that. I'm going to turn back to Allie to see if we have maybe time for just one more question.
Yeah, let's see if we can fit in one quick question here. And John, just real quick, walk us through how how the community came together to start the process of developing an application.
Sure. Most succinctly, I think I would say that we did a quick asset map, an informal asset mapping of what's going on in our community, specific around those criterias. And honestly, as we did that, we also did a little bit of a gap analysis to figure out where are things that we need to work on and what should we look at next year. One thing, again, not to just keep pointing back to you guys, but one tool that we learned of later, that intervention planning matrix, I think would be another great place to look as we're doing that. I think that's a tool we'll use in the future to help identify where are those opportunities, what has been done from a program to a system and policy level, from the individual to the community as a whole. So I think that's the process we'd use informally, and I think we'll formalize that this next year.
Well, great. Thank you so much, John. And just as a quick heads up, the intervention planning matrix that John referenced is a tool that's in the Roadmaps to Health Action Center, and you can find that online in our Choose choose effective policies and programs step in the Take Action cycle in the Roadmaps to Health Action Center. So just a quick reference to where that tool can be found and what that was in reference to. So, John, I want to again thank you so much for sharing your experience with us, and then also I want to take a moment to acknowledge that this program is the result of the contributions of many partners, including those that we've listed here. I'd like to encourage you to check out our upcoming and archived webinars. You can learn more on our website, and you can also make sure that you don't miss any upcoming webinars by signing up for our e-newsletter. And you can sign up for that by emailing us at match-info@match.wisc.edu. And thank you again so much for taking time to join us for this short webinar. We look forward to your feedback and to seeing you on future webinars. Have a great day.